Hi everyone, welcome to my channel. My name is Nurse Marsha, PHRN, QRN, and USRN, and I'm here to help you ace the NCLEX-RN exam. Today, we'll be tackling an advanced NGN-style case study on chronic kidney disease, CKD, a topic that challenges critical thinking and clinical judgment. Let's dive right into the case and questions. Case scenario: Mrs. Linda Harper meet. Mrs. Linda Harper, a 62-year-old female with a history of type 2 diabetes mellitus, hypertension, and stage 4 CKD. She presents to the emergency department complaining of worsening fatigue, shortness of breath, and swelling in her legs. She also reports nausea, decreased appetite, and itchy skin. Her vital signs are BP 172/98 mmHg, HR 92, BPM, RR 22 breaths per minute, SpO2 94% on room air. Her lab results include the following image. Let's start with the questions. Question 1. Select all that apply. Which of the following lab findings indicate complications of CKD? A. Elevated potassium, 6.2 μQ per L. B. Decreased calcium, 7.5 mg per DL. C. Elevated GFR, 16 ml per min. D. Elevated creatinine, 4.6 mg per DL. E. Increased hemoglobin, 14 gram per DL. The correct answers are A. Elevated potassium, B. Decreased calcium, and D. Elevated creatinine. Rationale: elevated potassium and creatinine reflect impaired kidney function. Decreased calcium is caused by imbalances in calcium-phosphorus metabolism in CKD. A GFR of 16 ml per min is severely decreased, not elevated. Hemoglobin is low, not elevated in CKD due to anemia. Question 2. Multiple choice. What is the priority nursing action for her potassium level of 6.2 μQ per L? A. Administer sodium polystyrene sulfonate, Kxalate. B. Administer calcium gluconate IV. C. Initiate dialysis immediately. D. Administer a loop diuretic like furosemide. The correct answer is B. Administer calcium gluconate IV. Rationale: calcium gluconate stabilizes cardiac membranes, preventing dysrhythmias from hyperkalemia. Sodium polystyrene sulfonate and dialysis lower potassium, but take longer to work. Question 3. Matrix, multiple response. Match each abnormal lab value with its corresponding clinical manifestation. Lab value. Clinical manifestation. Answer: elevated phosphorus will be A. Pruritus low calcium will be B. Muscle weakness. Hyperkalemia will be C. Cardiac dysrhythmias. Rationale: these lab findings directly correlate to common CKD symptoms caused by electrolyte imbalances and poor kidney function. Question 4. Drop down. What does Mrs. Harper's GFR of 16 ml per min indicate about her kidney function? A. Normal kidney function. B. Mild kidney disease. C. Progression to stage 4, CKD. D. Progression toward end-stage renal disease, ESRD. Answer: the correct answer is D. Progression toward end-stage renal disease, ESRD. Rationale: a GFR below 15 ml min indicates ESRD. Mrs. Harper's GFR of 16 ml min shows progression toward this critical stage. Question 5. Extended multiple response. Which clinical findings are consistent with CKD-related uremia? A. Fatigue. B. Metallic taste in the mouth. C. Increased appetite. D. Nausea. E. Peripheral neuropathy. Answer: the correct answers are A. Fatigue. B. Metallic taste in the mouth. D. Nausea. And E. Peripheral neuropathy. Rationale: uremia, a buildup of waste products in the blood, causes symptoms like fatigue, nausea, metallic taste, and neuropathy. Question 6. Drag and drop prioritization. Arrange the following interventions in the correct order of priority for hyperkalemia management. Administer calcium gluconate IV. Prepare the patient for dialysis. Administer sodium polystyrene sulfonate, Kxalate. Obtain a stat EKG. Answer. The correct order is obtain a stat EKG, administer calcium gluconate IV, prepare the patient for dialysis, administer sodium polystyrene sulfonate. Rationale: immediate monitoring for cardiac effects is critical, followed by stabilizing the heart, planning definitive treatment, and removing potassium long-term. Question 7. Trend evaluation. Over 2 weeks, Mrs. Harper's GFR drops from 20 ml per in to 16 ml per min. What does this trend indicate? A. Her kidney function is stabilizing. B. Her kidney function is improving. C. Her CKD is progressing. D. She requires an urgent transplant. Answer. The correct answer is C. Her CKD is progressing. Rationale: a drop in GFR reflects worsening kidney function and progression of CKD. Question 8. Fill in the blank. When should phosphate binders be taken? Answer. Phosphate binders should be taken with meals. Rationale: phosphate binders are effective only when taken with food to bind dietary phosphorus. Question 9. Case progression. After dialysis, Mrs. Harper reports dizziness and muscle cramps. What is the first nursing action? A. Slow the dialysis rate and monitor vitals. B. Stop the dialysis session. C. Administer a hypertonic solution. D. Encourage the patient to drink fluids. Answer. The correct answer is A. Slow the dialysis rate and monitor vitals. Rationale: slowing the dialysis rate addresses fluid shifts causing these symptoms, while vitals ensure the patient remains stable. Question 10. Critical thinking. Mrs. Harper reports her skin is itchy, and you note multiple scratch marks. What is the likely cause? A. Uremia causing toxin buildup. B. An allergic reaction to medication. C. Elevated phosphorus levels. D. Poor skin hygiene. Answer. The correct answer is C. Elevated phosphorus levels. Rationale: high phosphorus causes calcium phosphate deposits in the skin, leading to itching. This is common in CKD patients and should be managed with phosphate binders and dietary changes. That's it for today's NGN-style CKD case study. If you found this helpful, give this video a like and share it with your fellow nursing students. Don't forget to subscribe and click the bell icon so you never miss an upload. Thanks for watching, and I'll see you in the next video.